Alright guys, welcome to this medication review for Lorazepam, aka Ativan. So Ativan is a CNS depressant. Again, this is a benzodiazepine, much like midazolam and Valium. It is an anticonvulsant and an anxiolytic. What is different about this one is Ativan is a much longer lasting benzodiazepine. So the effects last several hours longer than they will with midazolam or Valium. Which is why it tends, one of the reasons it tends to be used more regularly in the in-hospital setting than out in the field or in the pre-hospital setting. It works the same way though. It enhances the effects of gamma-aminobutyric acid, or your GABA, which again is going to depress the central nervous system, which is going to really suppress seizure activities. It's going to reduce anxiety, and it will relax skeletal muscle. What you will notice on here is that it doesn't really refer to the amnesic effects when we're talking about Ativan. It does have those same amnesic effects, however, they aren't as strong as they are with, say, midazolam, which is not really one of the primary uses of this medication. It's used more for the anxiety or the seizure activity itself. So again, our indications for use are going to be seizures, chemical restraint for those psychosis patients or the excited delirium, and then we will use it for sedation prior to RSI, cardioversion, or pacing to help make our patients comfortable. You will see our contraindications are a little bit different. So we do have our main contraindications are going to be hypersensitivity, of course. Again, we have that acute narrow angle glaucoma. Again, remember with this one right here, the concern is an increase in intraocular pressure, meaning that pressure is going to increase in the eyeball, which could cause permanent blindness inside that eyeball. So we do not want to use this medication for folks that have been diagnosed with glaucoma, specifically acute narrow angle glaucoma. And then drug or ETOH intoxication are always going to be contraindications because of the potentiation factor. Our dosing does get a little bit more complicated when we talk about Ativan. So when we talk about adult patients, it can be used for seizures. So when we talk about using it for seizures, our primary dosing regimen is going to be 2 to 4 milligrams, either IV or IM. We can repeat that as needed in 15-minute increments to a total max dose of 8 milligrams for that patient. So 2 to 4 milligrams IV, IM. Repeat as needed every 15 minutes to a max total dose of 8 milligrams to treat seizures in adults. To use it for sedation in adults, it is going to become a weight-based dosage. So we're going to go 0.05 milligrams per kilogram IM with a max single dose of 4 milligrams. And again, why this max single dose of 4 milligrams? Because if you look up here, we have a max single dose of 4 milligrams there. So for sedation, we do not want to go over a max single dose of 4 milligrams. And again, our max total dose is going to be 8 milligrams. For your pediatric dosage, we only use it for seizures in pediatrics. So your dosage, always in pediatrics, weight-based, right, is 0.05 to 0.2 milligrams per kilogram. That will be IV or IM. We repeat as needed every 15 minutes, and your max total dose for your pediatric patients, again, is to be 0.2 milligrams per kilogram. So remember, if you dose them heavy in the beginning here at the high end of your dosing regimen, you've just eliminated your ability to deliver a follow-up dose for these patients. So max total dose 0.2 milligrams per kilogram in your pediatric patients. And I think you'll notice with this, you notice that in your contraindications, you did not see hypotension or shock, and that's because the hemodynamic effects of Ativan are much less than they are with your diazepam or your midazolam. So your Valium and your Versed have much greater hemodynamic effects than Ativan does, which means that we can use this in patients that have more of a borderline blood pressure. But again, this is more commonly used in fixed facilities, not so much in the pre-hospital environment. So I hope this helps you guys with this week's med. I'll see you on the next med review.